Warning, this is a public service announcement. Don't be foolish and call those 1-800 number Medicare ads that you see on TV or the flyers you get in the mail. Do not be deceived by those Medicare ads that you see over and over on TV or even on the internet or the ads that you get in the mail. Hi, I'm Chris Prang, the Medicare analyst, licensed agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see that list at the end. This is a public service announcement for you, and it is frustration for me for what is going on when it comes to these agencies that are marketing to Medicare beneficiaries and the trouble that many Medicare beneficiaries are getting into. You may remember from years ago, Mr. T, when he said, "I pity the fool." Well, I pity the fool that doesn't have the discernment when it comes to calling these 800 numbers and dealing with these agencies. These are large agencies, large call centers. You're dealing with agents that you will never see or hear from again, more than likely. And most of them are doing a disservice to you. Perhaps you have seen some of these ads on TV. The most famous, of course, is wonderful Joe Namath, Broadway Joe. He ought to be ashamed of himself, quite frankly, for the ads that he is doing. You see those probably a lot, especially around the annual election period. You take a look at some of these ads. We got one here. He talks about getting what you deserve. Joe looks really, really angry. Joe should be really angry about not what you're not getting, but the fact that you're getting taken advantage of. That's what he should be upset about. And then we have good old Kid Dynamite, Jimmy J.J. Walker. And of course, we have Captain Kirk, William Shatner, going where no man has gone before when it comes to Medicare. I would suggest not calling those. Take a look at some of these headlines over the past couple years. This one says, the troubled insurance sales firm behind those Joe Namath ads for Medicare Advantage. This company has been shaking off lawsuits and regulators for years. For years, get that. It's now peddling Medicare Advantage plans to seniors, where if someone picks a subpar plan, the results can be disastrous. Yes, they can. Here's one from the Wall Street Journal. Celebrity Medicare sales pitches are toned down after scrutiny. A little bit, but not too much. Fortune. Aggressive Medicare Advantage marketing floods TV and mailboxes with misleading ads. The Biden administration is cracking down. I often tell people when I meet with them, when they ask me about those ads, or I just bring them up, and I tell them the ads are true, but they're very, very misleading. So you need to be very, very careful about what is going on. Here's one from the Associated Press. The Biden administration proposes crackdown on scam Medicare ads. This came out probably about a year and a half ago. This is from CMS, the Center for Medicare and Medicaid Services directly. It says CMS is particularly concerned with national advertisements promoting Medicare Advantage plan benefits and cost savings, which are only available in limited service areas or for limited groups of enrollees, as well as using words and imagery that may confuse beneficiaries or cause them to believe the advertisement is coming directly from the government. In addition, CMS receives complaints from beneficiaries and caregivers that highlight sales tactics designed to rush or push beneficiaries into enrolling into a plan. On the CMS.gov website, CMS issues new policies to provide greater transparency for Medicare Advantage and Part D plans. On the Healthcare Drive website, CMS cracks down on Medicare Advantage coverage denials and misleading ads in their final rule. And then in their final rule, they had stated that the final rule also includes stipulations meant to cut back on deceptive and misleading marketing for Medicare Advantage plans. Beneficiary complaints of inappropriate Medicare Advantage marketing more than doubled from 2000 to 2021, leading the Senate Finance Committee to launch an inquiry last summer. And it is about around 2019 or so, maybe 18, when you started seeing a lot of these ads. Before, what you would see for Medicare Advantage, you'd see Humana run an ad, you'd see United Healthcare. Goodness, most of the time I walk into somebody's house, they'd have the TV on, the commercial would come on, they'd show a Humana ad, and the next commercial would be United Healthcare. And then 5 minutes later, the ads would run again, it'd be United Healthcare, then it would be Humana. These ads with the Joe Namath and marketing and all these things were non-existent. And then all of a sudden these ads come on and people call And what do you know? The complaints go up. And the reason why is people are getting hoodwinked. They have no idea what in the world they're getting into. The odds of picking the right plan through one of these is slim. You may get lucky. Maybe you do have the discernment, but most people don't. So let's talk about some horror stories from calling these 800 numbers. So I've been selling Medicare insurance for almost 13 years. And in that time, I have sat in front of probably several thousand people. And if I sit in front of somebody and I find out they have the right coverage, I tell them they have the right coverage and we move on and they can call me later. But what happens is when you call these 800 numbers, you're going to go through a sales process. They're going to get your Medicare number. They're going to get your name if they don't already have it after you call in. And they're going to get you to say yes to certain agreements with maybe without you even knowing it so they can continue to proceed. And so one of the big challenges is people that have original Medicare plus a supplement plus a drug plan, they call the 800 number and the next thing they know, 30 minutes, an hour later, they are enrolled into a Medicare Advantage plan and they think everything is fine. Well, what they find out is it's not fine because their Medicare supplement no longer works with Medicare Advantage and their drug plan has been terminated. And the odds of these people checking your medication coverage to make sure you have equal or better than what you had before is pretty slim. Making sure that all your doctors are in the network is pretty slim. So the case of one lady, I had met with her originally. She had a drug plan and a supplement. I reviewed everything. Supplement made sense to keep. We changed the drug plan. A year later, we met again. Once again, supplement made sense to keep. Drug plan didn't, so we changed it. And a little bit after that, I noticed that she had disenrolled. Now, Medicare's got some really silly rules. One of those silly rules as an agent is if a beneficiary, one of my clients, disenrolls, I am not allowed to call that person. Thankfully, they have recently changed that rule. So I couldn't call her to find out what's going on. So about 6 months later, in June of that year, she ended up calling me, asking questions and trying to find out what's going on. So what she had done is she called one of those wonderful ads and they sold her all the pie in the sky and she got enrolled into a Medicare Advantage plan. Now, Medicare Advantage plan is fine as long as you understand how it works. And most people do perfectly fine on Medicare Advantage. Not everybody. But the big thing is you need to know what you have, how it works, and how it doesn't work. And she didn't know. So she had started going to the doctor and using her Medicare Advantage plan and her supplement. And she was getting all these co-payments because the Medicare supplement doesn't work with the Medicare Advantage. She didn't know what was going on. So finally, she calls me in June. She tells me what's happening. So I tell her, here's what you need to do. You need to call Medicare. I can't help her at this point. You need to call Medicare, and you're going to need to speak to a supervisor, and you are going to file a complaint against that agency. And unfortunately, that complaint also goes to the insurance company, which really isn't the insurance company's fault. It's this big telesales agency's fault. But she has to file a complaint, and she's going to file a complaint. And what I told her to do is file the complaint and tell them you want your drug plan back effective from January 1st. She got all that worked out, and then I told her to go back to your providers and have them resubmit all the bills and all the claims to original Medicare and your supplement. And she did that. About a year and a half later, actually just last fall, we met again and to review everything. And we had to change her drug plan, but not the supplement. I asked her how everything was going. A year and a half later after this, she is still having billing issues. Her fault was she called the 800 number and didn't know what in the world she was getting into. I had another lady who was in her 80s who had a little Alzheimer's and dementia, and the noggin was not working too well. This is a real crying shame. If I see somebody that's got mental issues and they can't make a wise decision, I ask for a friend or family member that can help them. If not, I move on. But these people in the 800 numbers don't move on. So this lady called. She had a supplement. She got enrolled in a Medicare Advantage plan. Luckily, she happened to get the right one. But what happened later was her family found out what she had done, and she had a supplement, and she was paying premiums all along that was doing no good. So they ended up canceling the supplement. More or less, it's worked out. But that's a horror story. I have another situation with a good client of mine who had called because he was interested in dental insurance, and the next thing he knew, he was enrolled, despite saying, I already have an agent, I have Chris Prang, I have my insurance through him, I don't want to change. And he said over and over, I don't want to enroll. Well, he got enrolled. And the funny thing is, as soon as he got off the phone with them, he called me up. And so I had to go through the process of having him get disenrolled and back to the Medicare plan that he had. Getting enrolled in an inferior plan. You could be on a Medicare Advantage plan, But these agents, they're going to sell you whatever you don't have, whether it's in your best interest or not. Like I said, if I see somebody's on the right plan for them based upon their medications, based upon their doctors, the benefits that are available, then I tell them. I have no problem doing that. These people are going to sell you whatever you don't have. So you need to be careful. And you get enrolled in an inferior plan where your medications aren't as well. Maybe there's doctors that are not in the network. That's a big one. They get enrolled in a plan, as I just said, where their doctor's not in the network. This has happened numerous times to my clients. They get put into a plan where there's not a big provider network. Now, part of that fault is actually CMS's fault for allowing these plans to go into areas where you have a very insufficient network. So you need to be careful with that. And as I've sort of alluded to, they've enrolled them in plans where their medication coverage is not as good. So those are some of the horror stories. I hope that you don't have a horror story. If you maybe do have a horror story, put it down in the comments section. I'd like to see it. So if you have questions, if you need help, go to my website, themedicareanalyst.com. There are a couple pages on there where you can put in your contact information and I will reach out to you and try to help you out. If you want to schedule an appointment, we can do that. If you happen to live within about an hour or so of the Charlottesville, Virginia area, and you'd like to meet face-to-face, I can probably work that out. Just contact me and let me know. So states I'm currently licensed in, other than Virginia, North Carolina, South Carolina, Florida, and Tennessee, with more states coming soon. And here's where you can help me. If you are watching from any other state other than Virginia, please let me know what state you reside in just by putting it down into the comment sections. If you like this video, which hopefully you did, and you got some benefit out of it, just click the like button. And if you want more ongoing content, click subscribe. And who do you know possibly that could benefit from this video? If you know somebody, then click the share button and send that on to them. Again, that is it. That is my warning. That is my public service announcement for today. I'm Chris Prang, the Medicare analyst. Make it a great